I'm Dr. Joe Norris from McLean County Orthopedics in Bloomington. Frozen shoulder, or adhesive capsulitis, as an orthopedic surgeon would call it, is a very common presentation to an orthopedic surgeon's office. The definition of frozen shoulder is truly that the shoulder is freezing up or having less and less motion over time. The causes are numerous. We know that diabetic patients and patients with thyroid disease have a 4 times higher incidence of frozen shoulder, but no one can really explain to us why. The capsule or covering of the joint provides a covering like the covering of a baseball around the ball and socket. That capsule normally is very pliable and allows our shoulder to move in any direction we would like. However, at times the capsule itself, the covering of the joint, can become inflamed and thickened and form these adhesions that we then call adhesive capsulitis or frozen shoulder. By definition, someone with frozen shoulder will have more and more pain and less motion over time. This can happen over a period of weeks or even months. And as we often refer to the process or natural history of frozen shoulder, it is the freezing, frozen, and thawing stage. Not a very unique descriptor, but nonetheless I think you understand the phases at which a patient will go through when they have this condition. The treatments are almost always non-operative to begin with and do not require surgery. Most patients do get better and will ultimately not experience the same lack of motion and significant pain with daily activities. A patient will often present with more and more pain and less motion within their shoulder joint. It's important to be evaluated by an orthopedic provider to ensure that we are making the right diagnosis with the right treatment. The treatment often begins with anti-inflammatory medication that is either in the form of an injection at the level of the shoulder joint or simply anti-inflammatory medication that you take in a pill by mouth. This is almost always in combination with aggressive physical therapy to increase the range of motion and decrease the level of pain. Without the help of my physical therapy colleagues or some anti-inflammatory medication to jumpstart the treatment of adhesive capsulitis, patients will often continue to have pain for several months before they ultimately present, which is unneeded and could have been taken care of much sooner.